Hello, my name is Taylor Ortolani. I'm a registered nurse at Longview Medical Center and I'm studying my bachelor's degree. I'm here to teach you a little bit today about diabetes and hypertension, also known as high blood sugar and high blood pressure. The first one we're going to talk about is diabetes, also known as high blood sugar. This can be very dangerous. It's when the body does not use sugar normally. There are some signs and symptoms to look out for that could send you to your doctor to get checked out to make sure you don't have diabetes. Some of these are on this pamphlet, which I also have in Spanish. It's by the door when you leave. Tiredness, frequent urination, thirsty all the time, hungry all the time. These are some things to look out for and some things that should have you check in with your doctor. Diabetes can cause a multitude of different things. Heart disease, eye complications, kidney disease, neuropathy or pain in the feet. It can also cause wounds to not heal as quickly, and these are things to look out for. Hypertension, also known as high blood pressure, the signs and symptoms of this can be very mild. It's called the silent killer because of this. So an otherwise healthy person could experience a mild headache every now and then and think nothing of it. So it's very important to get checked out regularly by your doctor and to maintain a healthy diet and exercise, which is something we're going to talk about. Hypertension can also cause a lot of different problems. Heart attacks, aneurysms, heart failure, weakened or narrowed blood vessels. These are some of the things that can happen with untreated high blood pressure. So it's very important to get your regular checkups. The good thing about these diseases is that both of them are preventable. So with a healthy diet and exercise, both of these diseases can be avoided, even if people in your family do have them, which makes you genetically predisposed for these. So here I have an example of a MyPlate, which is available online. I also have these by the door, and there's one in a children's as well, but it's very similar. So here we're going to talk about like half of your plate should be vegetables. They're very low in sugar, low in carbs. It's healthy for both of these. A small portion of breads or grains, a small portion of meats. But more importantly, we're going to talk about some choices that you can make every day that are simple. So some of them may be very easy to decide. Water or sugary soda. That one's easy. Water. Sometimes it gets a little harder. A nice mango or an apple. The sugar content in the mango is actually very high, so the apple is your better choice. I know, mangoes are better. Then, canned foods are always high in sodium, which is bad for people who may or may not have high blood pressure. So when you're looking down the aisles and you're going to pick out a soup, make sure you find one that says something like low sodium. Check the back's labels always. Sodium is very high in canned foods. So in conclusion, diabetes and hypertension are both preventable diseases with proper diet and exercise. You should see your doctor regularly for checkups, checking your blood pressure, and if you feel that you've been having symptoms, possibly checking your A1C level, which is a number that the doctor can check to see what your blood sugar has been over a period of time, rather than just right there when you're sitting in his office. So this is a valuable tool. Does anyone have any questions?
My sister-in-law has sugar, and when she give herself a shot, is she giving herself a shot of sugar?
That's a very good question. What she's doing when she gives herself a shot of insulin is she's creating a way for the sugar to get inside of the cell. So normally people who don't have diabetes, they have their cells floating around and they eat some sugar and it goes into the cell. Now, your family member has her cell and she eats sugar and it can't get in. So she has high blood sugar. The sugar is just floating around in her blood. Insulin is the key that lets the sugar inside of the cell. So what she's doing is giving herself a shot of a key to help her body to use the sugar normally.
Okay.
Okay? Anybody else have any questions?
So you're saying someone with diabetes, they don't really have that much insulin?
Sometimes they don't create enough insulin, and sometimes it's just that their body's not using it properly. There are two types of diabetes. Type 1 diabetes people are born with, and that's something that unfortunately we can't fix. But they can do a lot with their diet and things like that to kind of help control it. But they can't use insulin at all. But people with type 2 diabetes, which is what we're talking about today, they can help to control it with their diet and things like that. And they do create insulin, just not quite enough for their body to use it properly. Is that answered?
Yes.
Okay. Anybody else? All right. Well, I thank you all very much. I'm going to have all these pamphlets by the door. If you have any questions you'd like to ask me in private, just let me know. Thank you.